and welcome in to Your Health. Dr. Will Rutland, we are going to talk about something today that it affects so many people that I know and love, and I think it's probably the same for you and our audience out there. We're going to talk today about dementia, Alzheimer's. We're seeing more and more of it. I really want to kind of talk a little bit about how we recognize it, and also, is there anything we can do to delay, prevent, or help?
Well, absolutely. It's such an important topic. As you mentioned, it's something that we see with increasing frequency. We talk a lot about this in different areas of the popular news, but the bell curve of age is steadily marching towards those ages where dementia tends to manifest, and so we're seeing more and more folks who are dealing with symptoms of cognitive disorders. And there is something we can do about it. Lots, in fact. Lots of things that we can do about it. And new things coming all the time. So there is a hope at the end of this story. And some of that is even more hopeful here in Montgomery because we have some exciting things happening around mental health right now, this very minute. In fact, as you know, I work with the UAB campus here on our new psychiatry residency, which we're very excited about. We'll have 3 new psychiatry trainees starting in July of this coming year.
Wonderful.
Of this year,
wonderful.
Rather. So help is on the way. But in the meantime, and maybe even after they get here, there are things that we can do to treat dementia. And really step 1 is to identify the type of the big fancy words are major neurocognitive disorder. I'm going to call that dementia, if that's okay with you.
That's fine.
All right, so sort of identify what the type of dementia is. And there are multiple types you've probably heard of. Alzheimer's, of course, is the most prevalent. So that's one that we think of. You can have dementias that are associated with other diseases. So you may have heard of folks progressing into dementia who have Parkinson's disease. So it's sort of a late effect of Parkinson's disease. We can have some other ones that often come with sort of behavioral issues. So if you've ever heard of frontotemporal dementia, that's, you might remember Robin Williams, the comedian, that hit sort of this hit the popular consciousness with his death. So frontotemporal dementia. And then one that often pops up, and maybe we're very aware of here in the Deep South, is what they call vascular dementia. This is dementia that's secondary to cardiovascular health issues. And of course, we live in the stroke belt, and we live in the hypertension belt, and the diabetes belt. And so here in Alabama and Montgomery in particular, there are a lot of risk factors for, say, a vascular dementia. And unfortunately, a lot of these overlap. And so probably one of the most common sort of patient pictures that we see is multi-factorial dementia. So folks who have, say, vascular dementia plus a little bit of Alzheimer's, or vascular plus a little bit of Parkinsonian or something like that. And so your first step as a clinician is to identify what's going on. And then after that, there are lots of things you can do. There are medications that help slow down the progression. Now, I want to be honest with you. There's nothing that reverses the cognitive decline. But we can slow it down pretty well. And those are medications that you've probably heard of. One that's very common is memantine, memantine. So this is often prescribed. I actually prescribe it in psychiatry for some other reasons. It was a good med. Or there are what they call acetylcholine esterase inhibitors. Don't worry about remembering that. There's no quiz at the end of this. But in any event, there are a small number of medications that we can prescribe to help sort of slow things down, which is helpful. Once we've gotten to that stage, though, the hay, or the horse is out of the barn, or maybe the hay is in the barn, depending. So oftentimes what I counsel folks as they start to get a little bit older is to take measures to protect yourself against dementia.
There we go. Thank you.
And I'll be honest with you, an ounce of prevention is worth 10 pounds of a cure. And so really, that's where I would focus my efforts if I was concerned at all about dementia as a patient. And the things that you can do to sort of stave off any cognitive decline, or at least work to stave it off, are take care of your body. So, regular exercise, getting out and walking, maintaining a good diet. Any of the things that lower the risk factors for, say, cardiovascular disease are going to help. So taking good care of your body, staying social. So it turns out the most powerful thing you can do to preserve your mind is to socialize with people.
Great.
Now, that can be harder the older you get. You can get very comfortable.
True.
But the truth of the matter is, if you can get out there and talk to people, that's going to help protect your brain. So socialization, good healthy living, and then go to your regular checkups with your doc. They'll see those kind of risk factors manifesting on the horizon, and they can get ahead of them. And the earlier you intervene, the more of your brain power you're going to preserve.
What are a few of the common symptoms to look for when you suspect that somebody may be losing it a little bit?
So good question. The things that we think about are sort of loss of attendance to regular everyday things. The classic thing that they talk about is, are you losing your keys over and over again? Are you losing your wallet? Are you leaving the stove on when you shouldn't? Do you notice that you're having trouble sort of sustaining attention? Now, I want to caution everybody that's listening to this. If you're doing that, it does not mean that you have dementia. I actually have a wonderful friend who called me. He's in Boston. He called me last week and said, "Oh, Will, I'm afraid I have dementia. I'm 62 years old and I'm forgetting to do things. I lost my keys twice last week." And I asked him,